I'd like to thank you all for participating with us tonight. I know it's quite late for some of you, maybe even quite early in the morning for others. For those of you whom I've never conversed with, my name is Dr. Eric Kusher, president of SCORE Medical. SCORE is a company which focuses on science-based, clinically proven skincare products and services exclusively for the professional community. Tonight in particular, we're going to be focusing on a specific suite of procedures for the physician only, developed and offered through our partner company, the Ageless Regenerative Institute. These techniques and products are designed to offer the physician a comprehensive in-office approach to extract, harvest, and process stem cells from the patient's own adipose tissue or platelet-rich plasma for reintroduction into the skin for long-lasting, effective cosmetic regenerative effects. We should be together for about 30 to 45 minutes. Without further ado then, allow me to introduce you to Kristen Comella, the Chief Scientific Officer of ARI, who's going to guide us through a brief presentation and an overview of the system, followed by a Q&A session, and finally I'll come back to you at closing with details on how you can obtain full information on scheduling and participation if you're interested in pursuing the educational and practice-building opportunities. Kristen?
Thank you, Dr. Kusher. Thank you, everyone, for joining us and taking the opportunity to learn a little bit about stem cells and how they can be utilized in true regenerative medicine. Thinking about the Ageless Regenerative Institute, we are dedicated to standardizing and elevating the field of regenerative medicine through research and medical education. Ageless as a whole umbrella has been around for more than 10 years and has focused on educating physicians on a variety of different opportunities and techniques that can be used in the clinic today. We're collaborative with academic centers in the U.S. and researchers worldwide, and we have a faculty of subspecialists that are part of our community. The purpose of this presentation is to offer physicians guidance in a proven, validated, compliant outpatient method to provide both platelet-rich plasma as well as adipose-derived stem cell injections into their offices. So let's talk a little bit about autologous stem cells. So these are the stem cells that come from your own body, and in particular, I'd like to focus on something called adult stem cells. I think there is a lot of confusion out there about stem cells, and the general community and general public tend to think of embryonic stem cells when they hear the word stem cells, and they forget that there are, in fact, stem cells that are part of every one of us. And these are the adult stem cells that we're referring to. These are found in many different tissues, and their main purpose is to maintain and repair the tissue in which they are found. They can be found in both an undifferentiated type state or a differentiated state within those tissue samples. The thing that's unique about the adult stem cells is that they are multipotential, which means that they have the ability to differentiate into a subset of cell types, and they are not pluripotential. In other words, they cannot give rise to a full human being or baby. They are multipotential and can give rise to every tissue within an existing body. The other thing that's unique about adult stem cells is they may exhibit something called plasticity. What this means is that they're easily influenced by their environment. Whatever you put them into, they tend to form that. So in other words, if you place them into bone, they tend to form bone. If you place them into muscle, they tend to form muscle. So I'd like to talk a little bit about adipose-derived stem cells, which are a specific type of adult stem cell which is found in the fat tissue. These cells that are within there are different from blood cells. There is a subset of multipotential progenitor cells that have been found to be adipogenic, chondrogenic, osteogenic in their potential. So they can form things like fat, bone, cartilage, and what's very unique about the adipose-derived stem cells is they're angiogenic and vasculogenic in nature. So this is very different than the cells that are found in bone marrow in that they help with that production of blood vessels and vasculature. So some of the current methods used to isolate the adipose-derived stem cells involve using a technique called tumescent liposuction. This is a process that is done under local anesthesia, so the patient remains awake, and you're removing the fat tissue from the subcutaneous space. So it's a minimally invasive procedure that can be done fairly quickly in office. Once you isolate that fat tissue out, we do a washing procedure to help remove any of the red blood cells or the hematopoietic cells that are associated with the population, followed by an enzymatic digestion, which is typically done with a collagenase-based product, and then centrifuging to separate out different layers. And in particular, the layer of interest is called the stromal vascular fraction. The stromal vascular fraction contains a variety of different cells in that population, some of which include mesenchymal stem cells and endothelial and progenitor cells. These are the cells that we referred to in the last slide that are very angiogenic and vasculogenic in nature and can promote healing as well as differentiate into a variety of different tissues. After completing the centrifugation, we isolate that stromal vascular fraction and wash the cells by centrifuging. After that, we do a filtration process to help separate out any fibrous tissue or any chunks of undigested material, followed by preparing the cells in the final suspension for injection. This next slide shows a picture of the separation after centrifuging. So after completing the digestion process with the enzymatic digestion, you can then centrifuge and create multiple layers. If you look at this slide, the top layer is referred to as the liquid fat, followed by the fat below that, and then the media, which is used to separate, which is just the enzymes which are used to digest, and then at the very bottom you have a multiple layer of cells. So at the top you have a white ring, followed by, at the bottom, a red ring. So this is going to be referred to as your stromal vascular fraction. And this is the fraction that is of most interest. These are going to contain the cells that will be used and can be used for degenerative type diseases, or as well as in plastic surgery type applications. Some important considerations when doing these processes within your clinic are that you want to maintain sterility. We feel that it is essential to work underneath what is called a laminar flow hood to avoid any sort of contamination. When you're doing this, this provides sterile air, which is class 100, which means that there are less than 100 particles per million in the environment that you're working in. We validated this process to include working underneath the laminar flow hood, and we use a hood that's actually very realistic for a clinic type setting. It's portable, it's tabletop, it's less than 25 pounds, and so it's something that you can bring out and work under and then put away when you're not using in order to conserve space. The other thing that's essential is doing the washing procedures to remove red blood cells. It has been found that red blood cells can actually prevent the stem cells from doing their job. So it's important to reduce the number of red blood cells associated with the population when offering these treatments to patients. The other thing that's critical is filtering or separating out any of the fibrous materials prior to re-injection. So you want to make sure that you've got a clean sample going back to the patient. And finally, very critical, having a defined and validated cell product. Keep in mind that we are using these products on humans, and so you want to be sure that what you're putting back to the patient is safe and appropriately validated. The next slide shows some of the results from about 60 cc's of fat, and what we typically see is that we are able to isolate about 1 million cells per cc of fat. And when I say cells, this is the mixture. This includes the entire stromal vascular fraction. Within that population, you're going to have a lot of different types of cells. And the way that you can determine which types of cells are in there is by doing something called flow cytometry. And you can look at the protein expression of those cells to determine which population is part of the isolated cells. One of the populations that we look at is CD34 positive cells. These cells have been found to be mesenchymal in nature, as well as endothelial and progenitor cells. It's a unique population, in particular ones that are CD34 positive and what's called CD31 negative. These cells, when they're isolated immediately from the body, have the ability to have multiple potential, including things like the ability to differentiate into bone, muscle, cartilage, and to create new blood vessels. So you can see here from this slide that we find typically greater than 50% of the cells in this population are expressing this protein of CD34. This is much higher than what you would typically find from a bone marrow sample. So, for example, from a bone marrow sample, we only get about 1% of the cells in this mesenchymal nature. So we can get up to 500 times more cells that are stem cell type population from fat tissue than we can get from a bone marrow sample. The other thing that's important to look at on this slide is that our viability is always very high. This is because we're dealing with fresh samples. So these samples are immediately isolated from the body and then immediately placed back into the body. If you think about cells, they're kind of like fish out of water. The longer they're away from your body, the less potent and the less viable they are. So the faster that you can get them back to the patient, the better off you're going to be. So when you see high viability, that's because we're dealing with something that is real time. We're putting it immediately back. Just for a reference, the limits, according to the FDA, are that you must have cells that are greater than 70% viable. So we're well above what is acceptable according to FDA regulations. Some of the other things that we typically look for are sterility. We want to ensure that we're not having any sort of breach of the sterility of the product because, in fact, it is going back to patients. You don't want to create an issue. And then also we look at things like endotoxin. These levels are way below what is acceptable limits for delivering back to patients. So let's talk a little bit about the regulatory considerations and what is and is not allowed within your offices today. The FDA currently regulates drugs, devices, and supplements, but the FDA does not regulate the practice of medicine. And most of the things that occur within a doctor's office right now are not FDA regulated or FDA approved. The state medical boards, however, regulate the practice of medicine, and these policies may vary from state to state. The practice of medicine, according to the Federal Code of Regulations 1271.15, allows for an exemption clause so that you are not obligated to follow the CFR 1271 if you are doing something within the same surgical procedure. So the reimplantation of an autologous cell therapy product during the same surgical procedure would be exempt from those good tissue practices. And there's a couple key things that are important there. The cell product must be minimally manipulated, and they must be for homologous use only. There are two types of stem cell uses, either autologous or allogeneic. Autologous refers to the implantation of the cells back into the same individual from which they were recovered, versus allogeneic, where you would be putting them to somebody else. Minimal manipulation include things like density gradient separation, which is what we would be doing with the process to isolate the adipose cells, cell selection, centrifugation, and cryopreservation. Once you're doing anything additional to the cells, including things like culture expansion, this goes beyond minimal manipulation. So illegal practices would include the cell culture and expansion or differentiation, or modifying the expression of the cells, so doing some sort of transduction to make the cells express a protein. These would all be considered illegal practices, and they would require you to go through the process of filing with the FDA to go through clinical trials. An example would be if you were to culture expand bone marrow cells for the use in orthopedic joint injections, the FDA would consider this an illegal practice. So what does this mean practically? There's no legal therapeutic use of allogeneic non-homologous cells outside of the FDA-approved clinical trials, and autologous homologous cells delivered during the same surgical procedure that are not more than minimally manipulated is considered the practice of medicine, and that is the field that we're dealing with. Some prudent cell practices: you want to consult with a healthcare lawyer in your state. You don't want to advertise that cellular medicine cures or treats any specific condition. You want to make certain that your fees are in line with similar procedures. And you want to make certain that your consent promises no specific outcome and states clearly that this is experimental medicine and not considered the norm. So how can you safely, legally, and ethically offer patients ASC treatments? follow the current ethical guidelines regarding stem cells, education and training on stem cell theory and procedural preceptorships, work with legal counsel to ensure legal compliance with all state and federal guidelines, use things like consents, appropriate materials, appropriate staffing, and get the appropriate accreditation. So what we offer is a stem cell training course. This is a 2-day training for both a physician and an assistant to come and attend at our clinic. We have, in the first day, we go over all of the didactic lecture series. We teach you everything about a variety of different types of stem cells, all the clinical research that has been done to date, and all of the different trials that are currently going on. We also teach you on the second day hands-on. First we teach you how to isolate the fat sample, followed by how to take that fat sample and get stem cells. In addition, we teach you how to do a technique called platelet-rich plasma, and we typically use these techniques hand in hand. So I always think of platelet-rich plasma like the fertilizer and the stem cells as the seed. So we place the seed into the fertilizer and we plant it. In other words, we take the platelet-rich plasma, put the stem cells in, and those can go back to the body. After you complete the 2-day course, we have a post-educational on-site at your own clinic where we send one of our surgical assistants to do your first cases with you to ensure that you've set your equipment up properly and that you're doing the processes appropriate. We provide all the written protocols required, QC assays, viability, cell count, and we also give you sample-informed consents and all of the different forms that you would need in order to implement this process into your own office. In addition, it's a fully accredited course containing 16 AMA PRA Category 1 credits, so you can obtain those continuing education credits as well. In addition to the 2-day training course, we have a variety of different modules which provide for additional training in specific areas. In particular, we have modules for fat transfer training courses. We have ones for breast, gluteal, and facial fat modules. In this case, you learn the techniques of doing autologous fat transfer using the patient's own stem cells and fat. We go through the anatomy for appropriate augmentation. We review injection techniques. We make sure that you understand anesthetic techniques and prevent and manage complications. These are all done on real patients in the clinic setting, and you have an opportunity to get some hands-on experience. Our process is validated, compliant, affordable isolation method for ADSCs. So one of the main issues to preventing people to moving into the stem cell field has been the high equipment costs associated with it, and also the regulatory limitations. Some of the devices that are currently out there are not currently approved by the FDA, and even if they were, the consoles can cost as much as $100,000, making it not realistic for most offices. So in this case, the equipment associated with the process is right around $5,000, making it reasonable to offer in your clinic setting. We also have consumables that go along with each patient treatment, and these are also very reasonable in cost. We provide competency training for both the harvesting and the isolation, and we have a quality assurance program. So included within that fee structure, we test the samples that you obtain to make sure that you are in fact collecting the right type of cells and that they are appropriate for use going back to humans. All of our kits and processes are made according to current good manufacturing practices, which is an FDA-regulated concept. We use actual clinical grade enzyme, which is approved for human use and could be used to directly inject into humans. And if you go to the next slide, this is a picture of our stem cell kit. So each patient uses one kit to process the fat tissue to obtain the stem cells. Included in the kit are all the plastics and consumables necessary to isolate the stem cells, as well as a vial of the enzyme, which is called adipolase, clinical grade and approved for human use. So once you move into the field of using stem cells in your office, you're going to get a lot of patients that are going to come to you and say, you know, my aunt has diabetes, or I have a friend who has heart failure, and we're wondering about using stem cells for those applications. So when we first started doing these trainings, we had a tremendous amount, and when we started offering these therapies, we had a tremendous amount of patients coming to us and wanting more. And these are things that we couldn't necessarily offer here in the United States. And so what we decided to do was partner with the Regenerative Medicine Institute in Mexico so that we could offer additional applications for patients outside the U.S. So in this case, we're looking at a variety of different applications. So if we go to the next slide. Let's first talk about some of the cosmetic regenerative tissue enhancement, and these are things that you can do here in the U.S. The first thing is looking at autologous fat transfer. If you do a review of the literature to date, there is a great amount of unpredictability with graft retention over the past 2 years. After 2 years injection, you can get as low as 50% retention of that graft. And so because of that, there has been a lot of debate as to whether or not fat transfer is appropriate to do and will it just go away. So there have been 2 scientists who have focused out of Japan. Yoshimura and Matsumoto have done quite a bit of research demonstrating that there is a 35% greater graft survival at 6 months when you isolate the stem cells and add those to the fat graft. The transplanted cells were expressed in the vascular endothelial cell markers. So the concept is that you can use cell-assisted lipotransfer or take autologous adipose stem cells and combine those with the fat tissue where you take half of the volume and make stem cells and then the other half with the fat and put those back in and then use it for grafting. So the combined fat and stromal vascular fraction or stem cells are then injected into the target site. The benefits include that the pre-adipocytes will actually differentiate into adipocytes and contribute to the adipocyte regeneration. So not only are you going to have retention of that graft, but you're going to have potential additional cells that are created there. Those will actually form the vasculature and give the tissue something to hang on to, so it will survive within the space that you put it into. There was a study completed by Yoshimura in which 60 patients were given the cell-augmented breast augmentation, and they showed that there was a 4 to 8 centimeter increase in circumference compared to a 2 to 3 centimeter increase with traditional lipotransfer. The post-operative atrophy was minimal, and the grafts were stable 2 months post-operatively. I'd like to share with you some of our patient results. In this first one, this is actually one of our doctors who completed the training, and while he was down in the training, we did a fat transfer. So the before picture is on the left, and the after picture is 6 months after surgery. So a variety of different things are occurring when you're doing the fat grafting with stem cells. Not only are you going to increase the volume, and you can see this is obvious, the increase in volume there and the reduction of all the lines, you're also going to increase the quality of the skin. The stem cells will actually promote the formation of new blood vessels, but also promote the production of collagen. So the skin is going to get a nice glow, and he's going to have a better tone throughout, a more even tone throughout the skin. If we go to the next picture, this shows another example of one of the patients that we've completed. And then if we go to the next picture, this shows an example of before and after doing the breast augmentation with the cells. So one of the issues and one of the concerns with doing fat grafting without stem cells is that you're going to have a loss of that tissue over time. And when you're doing a liposuction on a patient like this, once you take that fat out, it's gone. So if it disappears from where you just grafted it into, you're not going to have a lot of fat to go back and pull and repeat. So you want to make sure that when you do these grafting procedures, they're going to take. And the best way to make them take is to augment them with the stem cells. If we go to the next slide, this is another example of a breast augmentation. And then if we go to the next slide, this is an example of a study that we completed where we were looking at using the cells more topically after doing a resurfacing type procedure. And so what we did is we did a variety of different square tests on the patient where we looked at doing laser resurfacing and then applying the stem cells in a gel to the surface. So the box on the left was our control. We didn't apply anything. The second box we applied platelet-rich plasma only. And then finally, the third box on the right, this is where we applied stem cells plus platelet-rich plasma. And what we found is that we could have healing of that skin much faster by applying the stem cells and the platelet-rich plasma to the surface. So this is something that could be utilized for your patients that you're doing laser resurfacing and you want to promote healing much faster. So something that traditionally took weeks to heal, we could now heal within days. So let's talk a little bit more about the concept of taking these products offshore. As I mentioned before, you're going to have a lot of patients, once you say you're offering cell therapy products, they're going to ask you about other indications. Can these be used in things like diabetes or MS? And so what we did is we partnered with a center called the Regenerative Medicine Institute in Mexico, and we can offer these treatments at offshore facilities now. So if we go to the next slide, this shows some of the protocols that are currently available. We have more than 24 protocols which are approved by an IRB. And what we're offering is an opportunity to participate as an investigator in these clinical trials. So after you go through our training process, you would have the ability to send your patients for treatments at the center for a variety of different indications. So if we go to the next slide, this shows the hospital that we work in. It's called the Hospital Angeles Tijuana. This is one of the largest hospital systems in Mexico, and it is a full-scale JACO-certified hospital. It has all high-end techniques and appropriate equipment for doing all different testing, including MRI, C-scan, as well as all different cardiac applications. If we go to the next slide, this shows a few more pictures of the center there. The suites are all appropriate for both the patient as well as anyone coming with the patient to stay in. And then the next slide shows some pictures of the lab there, as well as that's a picture of the cath lab. And if we go to the next slide, shows all of the approvals and licenses of the facility. And we have some of the best scientists throughout the world representing us as part of our scientific advisory board. We go to the next slide. Dr. Keith March, who is the director at Indiana University Vascular and Cardiac Center of Adult Stem Cell Therapy. Dr. Sherman is the director of Cardiac Cell-Based Endovascular Therapies at the center at Columbia University. We have Dr. Ron Rothenberg, who is the director and founder of the California HealthSpan Institute. Next slide. Dr. Barakat, who is at the Center for Liver Disease at St. Luke's Episcopal Hospital. Howard Leonhardt, who is the founder of a company called BioHeart. And Dr. McQuillan, who is the founder and medical director of Ageless Aesthetic Institute, as well as myself. So the opportunity is that physicians may enroll their patients in these trials, and you will be compensated for your participation in the trial. So you would be responsible for doing screening of the patients. But then the other thing that is great is you have an opportunity to contribute to the data and publish the data. So now you're going to have an opportunity to get involved with some of these clinical trials and publish data on stem cells. So I'd like to share just a couple different results from that trial that's been ongoing. If we go into some of the clinical case studies. The first one is some of our cardiac patients. We typically deliver the cells using a catheter. It's guided by fluoroscopy, which is seen there on the right. And if we go to the next slide, this shows the improvement of some of our first patients. The first 4 patients we have 3-month follow-up on. And what we discovered is that on average, the patients are increasing about 15 percentage points in their ejection fraction. So not only are these patients feeling better, their quality of life improved, but their heart is actually functioning better by echocardiogram. If we go to the next page, this is a demonstration of their exercise capacity. The patients are able to walk on average about 100 meters further after having received the stem cells. And what this means, to put this in perspective, biventricular pacing is really the gold standard for cardiac patients, and biventricular pacing was approved with only a 20-meter differential. So we're looking at something that's 5 times greater than what is currently available. If we go to the next slide, this isn't so great because when it's in PowerPoint you can see the actual wound. So this patient had a wound underneath, non-healing ulcer, and was on the list for amputation. And so after applying the stem cells for this critical limb ischemia patient, what we found is that we actually were able to promote the wound to healing. We've done now more than 20 patients with critical limb. If we go back to the last slide, I just want to comment on the angiogram. So in this case on the left, you see this is the pre-angio, so minimal blood flow going through the leg, and then after receiving the stem cells at day 90, look at the perfusion and then the blood flow that has been increased there. If we go to the next slide, this was actually another patient that presented to us in which they had a cancer on the leg that was removed, and they did radiation and over-radiated and created a non-healing ulcer wound. This patient had this wound for more than a year and a half, non-healing, and came in to get stem cell therapy. Within 2 weeks of receiving the therapy, the wound was healing. We actually have an updated, but I don't have it updated in the slide. It's now been about more than a month, and the wound has healed even more. So we expect this to go into full healing. I'll share with you some of the COPD results as well. If we go to the last slide. So in this case, we've done probably about 12 patients on this trial, and in the first 5 patients that we treated, we see on average higher than 100-meter difference in their exercise walk capacity. Many of the patients are able to come off of oxygen and are able to function much better after receiving the therapies. So the point really is that there's a lot of opportunity, not just with using stem cells within your own office for things like fat transfer and cosmetics, but then you're going to have patients who are interested in more, and you also have an opportunity to apply those patients to different therapies that can be utilized throughout the U.S., and we can build a body of knowledge and move forward with these therapies and eventually bring them to the U.S. So at this point, I will hand the phone back over to Dr. Kusher, and thank you for your time.
Kristen, thank you so much, and I hope that you all found this extremely interesting, useful, and educational. What I'd like to tell you in following up is that I will finish this off after we're concluded by forwarding over to each and every one of you a schedule of our upcoming training sessions, costs associated, all of our contact information. So if you have an interest in pursuing this a little bit further, you'll have all the information you need to contact us, and you'll have all the education you need, not only from a clinical perspective, but also from scheduling and cost perspective too. Again, I want to thank you all. I know it's getting late for some of you, and please join us for our webinars that will be following over the next couple weeks to couple months. Thank you so much.